So Kamal, tell me what you heard. There was a press conference held by the families of the victims of Valdo Calocane.
Yeah, so not far away from the office here, near King's Cross Station, it was at a solicitor's office. The families held this press conference, and it was the families of the three people murdered by Valdo Calocane. That is Barnaby Webber, Grace O'Malley Kumar, and Ian Coates. So James Coates, Ian Coates' son, Emma Webber, Barnaby's mother, and Grace's parents, Dr. Sanjoy Kumar and Sinead O'Malley Kumar. And you just get this sense of people, sort of ordinary people, trying to fight the system.
Yeah.
And this is another NHS inquiry into the treatment before he murdered the three people of Valdo Calocane, which showed that so many opportunities were missed to section him, to put him in a secure environment where he could not harm members of the public, and oblige him to take his medication, which did mean that his behaviour was moderated. It mitigated his violent behaviour because of his paranoid schizophrenia. Neil Hudgell, who is their solicitor now, who's been acting for them since these appalling murders back in the summer of 2023. Let's just listen to him first, because he really laid out what this latest NHS inquiry report had found.
Without full reports, you wouldn't know today how frightened health professionals were to visit Valdo Calocane, how they withdrew on occasion, how they planned their exits, yet at the same time were willing to discharge him from care in the face of very obvious risks of danger. You wouldn't know the extent to which Valdo Calocane had insight into his own condition. He got better in hospital, he got worse when released. He knew what taking his medication did for him. It slowed him down, it impaired his studies. He didn't like needles. He also knew what not taking his medicine did to him. He knew how it made him paranoid, knew that it made him violent. All of this was known to health professionals who observed the stockpiling of medication at his home. Those same health professionals who could have insisted on the administration of long-lasting injectable medication, also known as depot, prior to release, but didn't do so. Undoubtedly, he was unwell, but he had insight and knowledge. He was not treatment resistant, he resisted treatment. He was discharged 9 months before these attacks when he did not show up for an outpatient's appointment. He was left to the general public to cope with. The NHS washed its hands of him. After 4 separate periods as an inpatient, no one joined up the dots. He was discharged effectively as a ticking time bomb. The way the families have been treated by NHS England in the run-up to publication of their report is sadly reflective of the family's struggles since the tragic events of June 2023. With all that said, even full publication of this report does not provide proper answers as to what went wrong and why, nor does it ensure proper accountability. That is because the report focuses on the systemic nature of failings and nothing more. The families expected much more from NHS England, recognising that true accountability in learning cannot be achieved without recognition of gross individual failings.
God, just listening to that and you think you've lost your children, or in the case of James Coates, your beloved dad, and there seems to have been such a cavalier attitude taken towards a guy described as a ticking time bomb, concerns about the danger posed to NHS staff, but not the actual public. And the other thing, he wasn't taking his medication because he was scared of needles. And yet he goes to violently stab 3 completely innocent people. And secrecy around publishing the full report. Sorry, what are you hiding? The public has a right to know what went wrong. And then once again, the sort of facile nature of a press release, which I read this morning when you were at the press conference, sort of giving this glib sort of lessons will be learned. It's not enough, Kamal.
They did at least apologise, but I tell you, the families here sat in that press conference room for over an hour answering questions, talking through, all the responses. Has the NHS done a press conference today? Have they put anyone up to answer the questions, the legitimate questions that not only the family have, but we as journalists have and many others will have? No, of course they haven't. As you say, we've got a one-page press release apologising for all the failings, but with no humanity. And they haven't put anybody up to answer any questions.
Shall we hear from James Coates, Ian Coates' son, Nottingham born and bred, who perfectly summed up how local people now won't be able to trust the local authorities?
It's a horrible thing to think about the future. My dad had grandchildren that in the next few years would be going to college and university, possibly in Nottingham. And the thought that they could be in the same situation that Barney and Grace were, it's unthinkable. It breaks your heart because there's nothing as an individual that you can do to stop it. You can't follow them around everywhere and be there to help them. They're independent. They've got to have their own lives as well. But the people that are there to protect them, the police and the NHS and those systems in Nottingham, the ones that are supposed to help them and keep our mind at ease are the ones that failed. And they'll continue to fail until there is accountability.
Yes, James was very powerful. There was a journalist there from the Nottingham Post who was actually congratulated by the families. Nottingham Post has done a huge amount of important journalism around this case. And then I think a real sort of almost gasp moment during the press conference was when Sinead O'Malley Kumar, the mother of Grace, she laid out why we have to approach people with mental health illnesses so differently from people with physical illnesses.
I'm going to address it as a consultant working in the NHS. I'm going to address that as a doctor from a medical family. And what I want people to understand is that when you go to work, when you get your paycheck, you do it with responsibility to do the best for your patients. Now, psychiatry is one branch of medicine where treatment of a patient does not just impact the patient and their well-being, it can impact the people around them. It is the only branch of medicine where a third party can be hurt, where a member of family can be killed, where a patient can take their own lives, where a patient can take the life of a complete stranger, where the patient can take the life of a child, where a complete stranger can take the life of my child because of their choice on treatment. Now, if you have cancer and you decide my disease is not curable, I choose not to have my treatment, that is your individual choice. But within the psychiatric speciality, it has to be remembered, it is not just the patient's health that is affected, it is public safety that's at risk. And I think for that reason, accountability is incredibly important. If any of those individuals thought that Valdo Calocane was going to go out and share student accommodation with their child, I suspect their choices may have been changed. If any of the healthcare workers thought that Valdo Calocane was the next door neighbour of their parent, I think their choices may have been slightly different and informed. I'm concerned about the empathy. I'm concerned about the 3D thinking and, of course, risk assessments and retrospection. I think there was laziness. I think there was, and I think all of this contributes to the fact that accountability on an individual level is essential.
Very powerful from Sinead there. Families are demanding a full statutory public inquiry. They are meeting government officials next week to discuss that. And also just to remind everyone, they also still believe that Valdo Calocane should have been charged with murder.
Yeah.
He was only charged with manslaughter because of diminished responsibilities, his mental illness. All of them say they, of course, agree that Valdo Calocane was seriously mentally ill, but he knew enough about that treatment helped him that he should have been charged with murder. The families made the very strong point that he was now a patient. He was actually getting better, and the Calocane family have said that they have, to an extent, got their son back because he's now being treated in a secure environment. But of course, for these family members, the father and the two children will never be coming back, and that was an incredibly powerful part of the argument. I then caught up with Emma Webber, and she told me why she is now, and all the families are demanding a meeting with the Prime Minister.
Yeah, we need the inquiry, we need the detail, the terms, and we need it to be statutory. And the second thing is, I would like to meet with our Prime Minister. I would like to meet with the rest of the Cabinet and all of those involved, not just the I being me. I think all three families would. That's the call to action from today.
This has been a day, Emma, when the focus has been on the NHS, but you obviously, of course, have been let down by many, many institutions. Could you just run us through all the institutions that have failed, just some of what could happen next in those other areas? And is that what you want to raise with Keir Starmer and presumably West Streeting?
Yeah, and the Home Secretary and the Attorney General and the Justice Minister, please, because that's how wide-reaching it is. If you imagine anything and everything that could go wrong did go wrong as a starter. We have two police forces. We have Leicestershire Police Force and Nottinghamshire Police Force who failed to stop the murderer. They failed to stop Valdo Calocane. There was a warrant out for his arrest from September 2022 that was never acted upon. When you delve a little bit deeper, you actually realise that there's many interactions with Nottinghamshire Police and him. He failed to turn up for a caution. He agreed to go for a caution for one of his other violent assaults. He didn't turn up. So what happened? Absolutely nothing. Nothing happened whatsoever. How can that be? With regards to Leicester, the police officers attended an assault on co-workers a month before he murdered Barnaby and did nothing. They could have stopped him. Had they bothered to do their jobs properly, they would have seen there was a warrant out. They would have seen that he had a history of violent offences, but they let him go. Well, they didn't even let him go. They didn't stop him in the first place. We had an investigation deeply flawed by a senior investigation officer who didn't even bother taking toxicology when he was arrested and taken into custody after he'd brutally murdered my son, Grace and Ian, and tried to murder 3 others, driving a van. He wasn't breathalyzed. There was no samples taken. He refused to have samples taken. This is just one example of many. And they did nothing about it. If you're refusing to give samples, why? If you've committed a crime of such a grievous nature, would you not belt and braces and do everything? We shouldn't have to be investigators. We shouldn't have to be criminologists. We shouldn't have to be lawyers and barristers and decision makers and politicians about this. They should just do their jobs properly. So that's the police forces didn't just fail beforehand. They carried out an appalling investigation, in our opinion. The prosecution was weak at best, ineffective, and utterly reliant upon expert witnesses that we now believe there's evidence to call that into question. So an enormous miscarriage of justice has been done.
Are there more reports to come out from the police into the inquiry of how Calocane was dealt with? Just what are the next stages in terms of other reports you're now waiting for? Because you made the very powerful point, and all of you, the families involved, that every time you have to go through this raises all that appalling trauma you're always going through. Are there more inquiries beyond the public inquiry that you want, that you are still waiting to see?
It's a good question. I think we alluded to the fact that so far that there have been, and we've been painfully involved in 9 separate investigations, reviews, reports, whatever you want to call it, across all the agencies. Those that have come in, almost without exception, are poor at best, marking their own homework. We believe anything that we've raised, particularly with regards to, for example, the CPS, we have pages and pages of questions that have just gone unanswered. They've never bothered to address them.
As Emma Webber summarises there, it's not just that the state has failed the victims. The state is now failing the families. The state is trying to close things down, trying to not give things the disinfectant of sunlight, getting them to sign non-disclosure agreements.
I was surprised by that. I didn't realise they had to do that type of thing. Yeah.
So they're being re-traumatised, and all they're asking for is accountability. How many times have we discussed the lack of accountability that is being taken by the organisations that fail people in this country? We said earlier, the press conference, the press release, no names are mentioned. Who is going to take responsibility for this catalogue of failures. And, you know, I'm sorry, call me cynical. Half of these people would have been moved on to different jobs, probably been promoted into different areas, and the family are left with what?
They demanded, yes.
They're left with grief, and they're left with lessons will be learned. No, that's not what they want. They want people to take responsibility for the mistakes that have been made. And I don't mean going around and having some huge blame game exercise that gets no one anywhere. I'm not even talking about scapegoating. But who has let these families down, and how are they going to make up for it to ensure, I mean, the central issue here is, and James Coates makes the point, how can we be sure that our children are safe in university against people who haven't taken their medication and could carry out the most horrific acts? How are we going to guarantee that? Because I don't feel that we're safe from people like Calocane. I really don't.
And just like yesterday, Camilla, a lot of the staff, the more junior staff, raised concerns about this man that wasn't listened to by the leadership. There was a demand about the naming of the psychiatrist who took the decision that this person shouldn't be treated or sectioned. Also, they opened the conference with this incredible fact. There have been 600 reports into violence connected with mentally ill people. 600. And we're still in this position of lessons should be learned. Well, we're not learning the lessons, are we?
No.
Just like
Nothing's been
yesterday,
learned.
we discussed we're not learning the lessons of the NHS disasters that have been in, previous decades.
Look,
We
Ruda
go through
Cabana.
this every time.
Look at Ruda Cabana. Again, those lessons haven't been learned. I can't help but think that there's a correlation in both of those cases, that what you're thinking inside is that both of those killers should have been institutionalised because they were that dangerous to the public.
And do you know what the NHS wanted to do originally with this report? They wanted to produce a sanitised executive summary that they wanted to publish on Friday afternoon. And so, of course, that's one of the low points in journalism. People are preparing for the weekend. If you want to get something out that you're trying to kind of shuffle under the carpet, when do you publish it? Friday afternoon, and you make it as boring as possible. And it is only, yet again, by the battle of the families. And as Emma said to me, we're not experts. No. We're not. I mean, fortunately, both Dr. Sanjoy Kumar and Sinead O'Malley Kumar are both clinicians, so they had some professional expertise in at least one area. But they're not the experts. But if they hadn't fought for this, it would have been manslaughter with diminished responsibility. The CPS were great. The police were great. The hospitals were great. He couldn't have been stopped. It's all very sad. Could everyone move on? And it's only by their battle, and frankly the support often of journalists and campaigners on their side, that means we are at least here and still asking questions which have still failed to be answered. Just like I said yesterday with Wes Streeting. Wes Streeting could make a real difference here as a health secretary, which would take out the politics if he responded to this and to what we heard yesterday about the errors at the Countess of Chester Hospital. And he did that, and he showed this time we are changing.